Welcome to Business Connection. I'm Liz Spencer. We're on location today. We're at Basko Dermatology, where we're going to learn all about skin health. So tell me a little bit about Basko Dermatology.
Yeah, thank you, Liz, for the wonderful opportunity to speak with you, as well as introduce Basko Dermatology to the residents of Naperville. So my husband and I founded Basko Dermatology back in November 2018. We really wanted to offer individualized, high quality, and compassionate care to the residents of Naperville, as well as the surrounding neighborhoods. So a little bit about me. I've been practicing now dermatology for over 7 years. I'm a Chicagoan at heart, so I went to University of Chicago for undergrad. I only left Chicago to go to Boston for medical school. I studied at Harvard Medical School.
Wow.
And then came back to the University of Chicago, where I completed my residency in dermatology as well as my fellowship in dermatopathology. After my training, I joined a large practice where I was serving as a dermatologist as well as a dermatopathologist. And I was also given the opportunity to really stay at the University of Chicago as a clinical associate to mentor residents and really train them during their residency program.
Wow, that's exciting. So tell me a little bit, there's a lot of dermatologists in the area. What makes you stand out?
Right. No, I completely agree. I mean, there's a lot of, dermatology offices here in Naperville, but I truly believe there are, a few things that really make us stand out. First and foremost, I would say the quality of care that we provide. Every patient who comes to Basko Dermatology really feels heard. Nobody who comes here feels like a number. We treat everybody, and we really take pride in that, in treating everybody like family. They receive personalized care. They will never feel rushed. I personally make sure that I spend a lot of time with my patients. I really address all of their concerns. I make sure we go over the treatment plan so that when the patient leaves Basko Dermatology, they know exactly what happens and they feel confident in the care they have received. And I can confidently say that, the online patient reviews that we have received are really a testimonial to the quality of care they receive here. In addition, I would say that my educational or professional background is a little bit unique. I am board certified in dermatology as well as dermatopathology. As you probably know, dermatopathology is the study of skin conditions under the microscope. So I feel pretty fortunate by being able to do both. I can see the patient in the clinic, I can look at their skin condition clinically, really at a macro level, and then I can go and study their skin condition under the microscope at the micro level. And so that is unique, and I don't think many dermatologists actually can do that. And it really enables me to do that clinical pathologic correlation, which I think is really crucial to really making the best and most accurate diagnosis for the patient, but also to come up with a great plan for them. A lot of dermatologists normally will have to pick up the phone and talk to the dermatopathologist to actually, discuss the case and see what the dermatopathologist saw under the microscope. But I truly feel fortunate that I can actually do both for my patients.
And I think that's a wonderful thing because it keeps it all in-house. It's not a waiting game. It's not necessarily a new person into their plan. It's just you. And I think that's a wonderful service.
I completely agree. There are certain conditions where you can have subsets of those conditions under the microscope. And depending on what type of cell I see under the microscope, I can actually tailor the specific medication. So that I think is pretty unique. I'd also have to add that our office is pretty efficient. My practice runs very efficiently. We are also high tech. We make it very easy for patients to make appointments, schedule appointments online. Our EMR system, everything here is electronic, so no papers around. When they come in, the check-in process is very easy, and a lot of those patients will comment on that. I also truly respect their time, and I will strive always to be on time and have patients wait no longer than 10 minutes.
Right. Well, and that's very nice because sometimes you can find yourself sitting for a while. Things happen. Tell me a little bit about the services that you offer here, because dermatology covers a wide range of services.
Right, that's correct. So we do offer a lot of services, starting with medical dermatology. We see patients of all ages, from infants all the way to the elderly patients. We really see bread and butter dermatology like acne, rosacea, hair loss, warts, all the way to more complicated conditions like an autoimmune connective tissue disorder like lupus or dermatomyositis, or an autoimmune blistering condition. In addition, I do provide surgical services that encompasses surgical removal of atypical moles, something as benign as a cyst or a lipoma, all the way to skin cancer. And then we do offer cosmetic services. We offer our patients a cosmetic consultation, especially first-time patients. I spend as much time as they would like me to spend with them, really going over a good skincare routine, as well as going over cosmeceutical products if they're interested in starting using a cream. We do injectables such as Botox and fillers. We have added hydrofacials, which is probably the hot medical facial nowadays. So a lot of young women and women in their 50s will come in for a hydrofacial. Soon we will start doing microneedling, which is a procedure to improve acne scarring. And then in the future, we are looking to expand our cosmetic services to offering laser treatments as well as cool sculpting. And as I've alluded to, I do dermatopathologist, so I actually do read almost every biopsy specimen from my patients.
So talk to me a little bit about skin cancer and what we should be thinking about and looking for ourselves and getting in contact with you about.
Right. As you probably know, skin cancer is the most common cancer in the United States. In fact, 1 out of 5 Americans is expected to develop a skin cancer in their lifetime. It's been estimated that almost 9,500, believe it or not, Americans will develop skin cancer daily. So we do take skin cancer very rigorously. There's many different types of skin cancer. The most common ones that we see here in the practice would be basal cell carcinoma, squamous cell carcinoma, and melanoma. Basal cell carcinoma is the most indolent type of skin cancer, usually from sun exposure. That's very, very common. The good thing is that it's not aggressive. It doesn't metastasize. However, it can be locally destructive. So we always take it seriously, and we always want to remove a basal cell carcinoma. There's squamous cell carcinoma, which can be a little bit more aggressive, especially in patients whose immune system is down. So somebody who's immunosuppressed, that squamous cell carcinoma can metastasize. So it can be pretty serious. And then melanoma, obviously that's the most serious, one of the most serious skin cancers because they can metastasize very quickly if not detected and treated early. It's been estimated actually that 1 American will die of melanoma every hour, which is scary. Yes. It's also, we used to think that melanoma is not for young people, but in women ages 15 to 30, it's actually the most common, or the second most common cancer. So it is important to be seen by a dermatologist and detect the skin cancers and address them early on.
Well, we're going into the sunny months, and we often don't think about sunscreen and sun protection as much. What would you recommend?
There's 2 components. There's two major risk factors, right, when it comes to skin cancer. There is obviously genetics, which we cannot change, and then there's sun exposure. It is very important to protect your skin from sun. So we always advise our patients to be very careful when they're outside, especially in the summer months. The best thing that you can do is to wear sunscreen. We normally recommend SPF 30 to 50. Wear a broad rim hat. That's for males and females. And then reapply that sunscreen every 2 to 3 hours. It's also very important to realize that especially for if you're going swimming and wearing a water-resistant sunscreen, you should reapply that sunscreen every 60 to 80 minutes. Otherwise, it's not as effective.
I think people forget that all the time. All the time. So if there was one thing that you would recommend to our viewers today, what would it be for our skincare?
Yeah, no, that's great. I'd say that if there's one message that I would want to relay to the viewers today, it would be see your dermatologist regularly. I cannot emphasize enough how important it is to be seen, annually. That's the recommendation for the majority of patients, unless there are other risk factors like a history of prior skin cancer, history of immunosuppression. In those cases, we do see patients a little bit more frequently than once a year. But it is very important because even something that can look very innocent to our eyes, such as a pink bump that is completely asymptomatic, can actually turn to be a deadly cancer. Amelanotic melanoma can present just like a pink bump. And I have seen many pink bumps even in young adults. So I think if there is one thing that I want to emphasize, it is go and see your dermatologist regularly, once a year to start with, and then more frequently if necessary.
I think that's a good thing to add that to our annual checkup list, is to the dermatologist. And you make it so easy and you're so warm and lovely. So thanks for letting me stop by and see your new space, and we really appreciate it.
No, thank you, Liz. Thank you, I appreciate it.